And welcome to our weekly blogs. My name is Dr. Hutchings. These are always being sponsored by Spectrum Med, and we're going to change gears a little bit. Before we get started, I hope everyone had a wonderful Thanksgiving. My family and I had a great little time off, so we do apologize for not having a blog last week because of the Thanksgiving holiday, but I hope everybody had a wonderful and safe holiday. So we're going to switch gears today. We've had some questions come in regarding to COPD and different issues with nutrition and the high risk these patients have for developing respiratory infections and also having exacerbations due to swallowing issues as well. So we're going to talk a little bit about COPD a little bit and discuss some of the things that we can be doing from a therapeutic standpoint to see if we can decrease their risk of developing any type of respiratory infection. So for COPD, obviously, these patients are chronic. They have issues with breathing, their shortness of breath, which also places them at risk for exacerbations, obviously, but also a tremendous risk for developing pneumonia. And we look at swallowing and breathing as a kind of a very delicate coordination. And we've said this before in previous blogs when we're talking about Alzheimer's disease. But when we look at swallowing, it's the only function we do in the human body in which we stop breathing for a split second. So therefore, if we have respiratory issues, that obviously is compromised. So one of the things we'll definitely look at, of course, the diet is one of the big things that we want to look at. The use of neuromuscular electrical stimulation to strengthen that throat and to strengthens that swallow is something that we've seen in the literature to be very positive amongst this population as well as others. So certainly the Guardian Way and the use of E-stem to help treat that disorder or that pathology has been shown to be tremendously helpful with these patients. So definitely diet. We know to stay away from dry and crumbly foods, those types of things, because these patients do have sudden inhalations when they are eating. And that's what causes them for risk for obstruction or even, again, the respiratory infection, pneumonia. Next thing I was look at fatigue and look at how long does it take for this patient to fatigue, and maybe combine that with your diet modifications to make sure that meal times are mirroring up with the patient's endurance levels. And the last three things I would say is number one, definitely utilizing maximum phonation time to help improve some of that respiratory strength. The normative data on this is for young males should be at about 28.5 seconds. For young females, you're going to be at 22.7 seconds. For elderly females, it's going to be 13.8 seconds. And for elderly, for elderly males is 13.8. So elderly males 13.8, and then elderly females is 14.7 seconds. So making sure that we're trying to get to as close to that normative data as possible without fatiguing the patient. Next is one of the most characteristic things we see clinically is these patients will commonly swallow and then inhale, which is the opposite of what the normal physiology is to swallow and exhale. So we want to make sure that we even can write goals on that, is to make sure that we are increasing that coordinational pattern of swallow, exhale, swallow, exhale. Also, when you're doing your MPT exercises, you can utilize a lot of the wonderful and well published exercises on the Lee Silverman voice treatment is always something that we could look at as well. So by the time we look at the diet, how long is the endurance levels, the fatigue pieces, decreasing meal times, incorporating your MPT with your maximum phonation time, normative data, maybe some LSDT techniques, and again, getting them to reverse the pattern that we see of breathing and inhaling and actually wanting them to breathe and then, or swallow and then exhale. So these are some great common things that we can do for COPD patients. You are not respiratory therapists, but these are things that you can certainly do to help this patient population. So again, thank you for tuning in. Keep the emails coming, and we'll keep driving our weekly blogs based on the requests and emails that we receive. Thank you.